Chris, thank you so much, and welcome. Good morning, good afternoon, good evening. I had the fortune of seeing a list of the people who had registered for this event, and know for one that it truly is global. I think our furthest east partners are over in Asia. Perhaps Vietnam is the furthest I saw, but possibly people further east than that. And I know we have people joining us from the very edge of the West Coast in America. So thank you all very much for joining this roundtable. My name is Christopher Egerton-Warburton, or Edge, as many of you know me, and I'm delighted to have with me an extraordinary group of panelists to discuss this roundtable on connectivity. With further ado, we will move through some introductions. All of you have got here will have gone through one of our poll questions. We have two more poll questions which we're going to be asking. Then we will move through to some remarks and discussion. Once again, thank you for those just joining, and welcome to our roundtable, which has been arranged and organized by SystemOne. So with me today, I have Dr. Sabira Tahseen, advisor of the National TB Reference Laboratory. She is joining us from Islamabad today. We also have Dr. Alex Durena. Alex is with USAID, is currently joining us from Ethiopia. So thank you very much for making the effort to join us, Alex. We also have Sule Abah, who is currently joining us from the Global Fund, where he's responsible for activities in Southern Africa and part of the grant team with them. We also have Neha Agarwal, who's with us from PATH, the implementing agency, and Janet Robinson, who's with us from 360 FHI. I can say for one, we could not have and we have Chris Macek here also, who's the CEO of SystemOne. So good morning, good afternoon, everybody. As I said, a really exciting panel here, but let me hand over to Dr. Tahseen, please, to say a couple of words of introduction. The microphone is yours, Doctor. Over.
Thank you, Edge. So I'm Sabira Tahseen. I'm working as advisor for TB Laboratory Network for Pakistan National TB Control Program, and I'm working with the program since 2010. And we started having our first gene expert machines was installed in 2011, and we started connecting these machines in 2017. Currently, we have around more than 600 machines, and out of these, we have around 450 sites, and we have around 90% of the machines in the system are now connected. So this is my brief introduction and the reason for being in the group today. Thank you.
Thank you very much, Dr. Sabira, and a very deep apologies for the mispronunciation of your first name previously. Alex, can you hear us?
Yes, I hear you. Can you hear me well?
Yes, we can. Please proceed. The floor is yours.
Thank you. Thank you. Good morning, everyone. I'm Alex Durena. I'm part of the team, which is a unit of the TB division in USAID Washington. For the decades, USAID has been providing medical and financial support to 26 countries. And over the past 2 years, USAID has been supporting the implementation and maintenance of connectivity solutions in 9 of the 26 countries, mainly to the IDS, to the Infectious Disease Detection and Surveillance Project, best known as IDS, and also to the inclusion or INTP. INTP is managed as a TB partnership. These two projects, we have 2 main providers: SystemOne, today, we develop Aspect, and Sabix, which develop data to care. Those are 2 good solutions. However, in 3 priority countries, which are Uganda, Kenya, and Ethiopia, we have to experience the development and maintenance of a robust, locally developed own solution, which provides super results and is more adaptable and affordable than the two other platforms on the SystemOne and Macek. So it's a real pleasure for me to join you all today and to share the experiences that we had while supporting connected solutions in those 9 countries. Thank you.
Excellent. Thank you, Alex. Sule, would you like to come next?
Thank you so much. Much a pleasure to be here like other colleagues. I'm an enthusiast of technologies that save life. I'm here in personal capacity. I work with the Global Fund and been part of this solution for a very long time. I work mainly in Africa, and I have personal experiences of the game-changing roles of technologies in improving health, saving lives, and also getting us the best value for money. So I can just say that it's much a pleasure to be in this forum. Thanks so much.
Fantastic. Thank you. Neha?
Good morning, good afternoon, good evening, everyone. My name is Neha Agarwal. I co-lead PAT's Global Diagnostics Program. Within PAT, especially including our diagnostics program, but also including multiple programs across PAT, including our primary healthcare division, Digital Square, which falls under our Digital Health Center of Excellence. We are really excited about the value that connected diagnostics can bring, but we also understand that there are quite a few gaps and outstanding questions around the value proposition. So we're really excited to, I'm really excited to participate in today's discussion, and I look forward to the discussion with all of you. Back to you, Edge.
Fantastic. Thank you so much. And Janet?
Thank you very much, Ed. So good morning, good afternoon, good evening, everyone. I'm delighted to be joining this eminent panel on connectivity. I'm the Director of Emerging Infectious Diseases and Health Security for FHI 360, which coordinates and leads all of our support to diagnostics globally, although our work is predominantly in low and middle income countries. You know, I've worked in diagnostics for over 40 years now, and the last 20 being with FHI 360. Connectivity is a real game changer going forward, and there are challenges, but you know, it's exciting to have this discussion to see how we can further advance connectivity. And just to let you know that I'll be speaking about my personal opinions and not what FHI 360's opinions are on connectivity. Thank you. Back to you, Edge.
Fantastic. And last but not least, we have Chris here. Please, over to you, Chris.
Thank you, Edge. Good afternoon, good evening, good morning, everybody. My name is Chris Macek, and I'm one of the founders and current CEO of SystemOne. And my background is in technology, so I've been one of the system architects for GX Alert and Aspect over the past decade or so, and worked in dozens of countries trying to help NGOs and governments set up their connectivity and make sense of the data and use it for insight. So I know some of the challenges from the ground up. Thank you.
Fantastic. And I should have said at the beginning, but just to reiterate, and I think a couple have mentioned it, we are following the Chatham House rule in this roundtable, and people will be speaking in a personal capacity. The meeting may be referred to, but quotes are not going to be attributable to specific individuals. I hope that's acceptable to all parties. So with that and without further ado, I believe we're going to now move to two quick questions, which are going to be posed coming through for the poll. This is where we have to trust in the science.
Edge, I think we're starting to see, more than half the people voting here and some patterns kind of response coming through, or at least main answers coming through in the percentages. So we can probably continue and just watch as those flush out.
Fantastic. So we're going to start by with a few questions which I'm going to pose to the group. The first, if perhaps Dr. Sabira, you could just give us your perspective on whether connectivity is a nice to have or a must have in these days, and how does Pakistan see it and implement it as part of your national strategy? Over.
Thank you. I think nowadays connectivity is something which is must. And for example, we started connecting our machines in 2017, and it's now almost 90% of the machines are connected. So now we are so much used to getting real-time data and patients and the clinicians getting the information, that once these services are suspended, we really feel lost. So this is something which is must, and I think the need is to find a more cost-effective, more local expertise to implement these things in the future. Thank you.
Fantastic. And maybe Sule, from the Global Fund's perspective, and or your personal experience in implementing programs in these countries, how do you now feel about connectivity these days?
Thank you, Chris. I'll speak in my personal capacity, and I like to say that the kind of decisions we make, I think in places where we work, in the context where we work, requires that we'll have real-time information about patients so that decision can be made. A clinical decision can be made and then to put patients on the right regimen at the right time, and then the overall goal is to save lives. So I think, and I believe strongly, that connectivity, forget about cost, forget about other challenges. I think it should be a must. Put other factors aside, because of the inherent, the inbuilt capabilities to bring to bear things that were impossible in the past. I started my career from a very rural community, and I can tell you that if a patient comes to you, normally what you do is to send a patient for a test in a lab. The patient takes the test, and probably maybe a district hospital or a general hospital somewhere 100 kilometers, 200 kilometers away, the patient come back and wait for the result to come in. It may come, it may not be the patient's result. You know it better than I do. So I think strongly that anybody who has the kind of experience I have and the kind of background I have will really jump at whatever capabilities that connected devices have to offer us in this modern age. So it should be available to everybody.
Fantastic. And Neha, maybe just to ask the perspective of the device manufacturers and developers that you're seeing coming through. Do you feel that there's that match? Are you seeing? Does the system share the same views as we've now heard from Pakistan and from Sule about the need for connectivity and the ability to create it?
Yeah, great question, Edge. I think from the perspective of device manufacturers, there's definitely an interest, and they definitely see a huge value proposition for being able to digitally connect their devices. I think what's a bit unclear from their perspective is really understanding what is the sustainable business model that they can operate in to be able, to be able to ensure that the connectivity solutions that they develop are really integrated and that there's a long-term solution for data exchange and better data decision making. From my perspective, working in the global public health space for some time now, I think when we think about connectivity in the sense of information management, being able to make data-based decision making, and also being very patient-centric and being able to say, look, connectivity allows us to better serve the patients. Absolutely, connectivity is a must. I think where we sort of get lost in the global health space is when we're talking about connectivity versus sort of digital connectivity, which is a solution to support more patient-centered care and to support limited loss to follow-up. I think there we need a bit more intentionality around what we're developing and how we're developing it and who is actually benefiting from that information. I think there's a lot of connectivity solutions out there that actually bypass the most accountable stakeholder in that connectivity pathway, which is the patient. And so I think, again, from the public health perspective, being able to connect the dots all the way across the value chain is still something that we need a bit more efforts on. And I was looking at the chat and somebody talked about the need for, or one of the poll questions that came out on top was the need to get away from our siloed ecosystems. I think that's one big step that we could take in sort of really turning the digital connectivity piece into a must-have.
Thank you so much. And Janet, maybe if I could bring you in, and maybe you could also touch on some of the results that are coming through from the polls. I see the most important thing in selecting connectivity is local ownership and this ability to link with other systems, followed by local support. Does that mirror the experience that 360 FHI's had in deploying programs globally?
Thank you. Yes, absolutely. Great question. And I would say the poll does very much mirror, what we're finding in our support to countries. If there's not that local ownership and local leadership of connectivity, it becomes something that is not embedded within the national program, then it doesn't become sustainable. And so connectivity solutions that meet the needs of the country are not enforced on the country, that can be adapted to local needs, and then they clearly seem to be supporting the national programs. And I agree with what Neha said around looking across the diseases, because connectivity has the potential to exchange information from multiple instruments, and we think about the patient, they have both preventive and curative needs, and connectivity that can move towards providing all of the information to better care for the patient is the way to make it more sustainable and locally appealing. Thank you.
Fantastic. And Chris, I'm going to come to you, if I may, after the next question. Dr. Sabira, I really wanted to dig in a little bit about saying, well, it's great to have this connectivity, but we've had paper-based solutions for a very long time. They reach deep down into rural communities. They give a lot of data, and people have had long experience of working with them. Do you find that now that we are in a more digitized operating environment, that actually makes a difference? Are there things which you can do now which you couldn't do before? And are you seeing change other than just the ease and efficiency of having the results pop up on your laptop?
Thank you, Ed. So yes, definitely this is one of the advantages, that you don't have to struggle to get data from all the health facilities, and previously it used to take us 1 quarter just to get a data of the previous quarter. So now in the end, we are only left with 10 or 15% of the facilities which are not connected, from where we have to get data collected manually. So this does make a difference, and this does give us a time to do other things. But I think the data which is collected is a large number of data, and we are looking at so many variables. So there is, besides giving notification, means bringing patient earlier to the care, we can, this data is not being utilized to monitor. We are getting these data, we are getting test on the utilization, but this data can also be utilized to look at the trend of utilization, the trend of diagnostic performance. We can also, it would be very nice if this data is presented in a user-friendly manner, in a good dashboard, from top managers to the facility staff, to see their trend over time. Means I, sitting at the top, would like to see what is how many tests, not only how many tests are performed, but what are diagnostic, what is over the years, how our diagnosis is trending. And also, for example, from the equipment maintenance point of view, if we could link the data on the error with the service provider, that would help in also the maintenance of the early maintenance. So there are many other potential gaps which we already have the information. It's just making it more effective, working hard to make it more effective from the logistic point of view, from the maintenance point of view, and also from the epidemiological trend, which we can use these data for information. And for that, we are currently doing a lot of manual effort to do that trend analysis, which can be done electronically with the data available, captured from different facilities in the country. So I think the technique has a lot of potential, and we are the technique is there, but we are lacking in what can be achieved. We are lagging behind what can be achieved with that kind of data that is being collected through connectivity. Thank you.
Fantastic. And perhaps, Chris, if I may bring you in at this point. I mean, SystemOne has been in this field now for for over a decade. Clearly, during that time, it seems that you're on a never-ending treadmill between both the potential that data can offer, but how do you find just is the ambition keeping up with what you can actually do, and how do you see the evolution of the data challenge coming forward to help partners like Pakistan with this key TB program, amongst others?
Thank you, Edge. We've been in this for about a decade, and one of the reasons we started was we thought there could be some efficiency from the point of view of designing it as a piece of software from a software development company, as opposed to a project, with a limited funding scope by a donor or an NGO, so that we could be in it for the long haul, and that we could get economy of scale by building something and providing it to many countries. They can share the cost of that system, as opposed to each country sort of building their own homegrown solution that's largely duplicative. But if each country makes their own local version, it's hard to necessarily share that or fund that. But as people have pointed out in the poll, the continuity of funding is challenging, not only for the countries, but also for providers like ourselves. For instance, it's hard for us to really leverage economies of scale, because we can't get a contract that spans multiple countries, for instance. We're typically dealing one country at a time, maybe 2 years at a time in terms of contract and how we can price and sort of build in that economy of scale. I also noticed that as different devices come online, and there are many manufacturers out there in the field and providing diagnostic capability, but there's not a clear standard for what it needs to do, how their devices need to communicate, what information needs to communicate in what way. And so we're still, as we work with countries and they bring in new devices, it's still challenging to easily get those devices to connect to a single system. And that's what we're looking to provide, across diseases and across devices, a single sort of global solution that's supported by many people.
And so, Chris, just perhaps following from that, I see that in the poll, the biggest desire was to link into the national system, and the HDMS system is obviously the national standard. My understanding is that SystemOne, that's where SystemOne has historically operated with that connectivity, but it then talks about local ownership and local support. How important do you see that the need to deploy local teams in parallel with your solutions?
Yeah, it's definitely important, and often in countries we'll work with a local partner. Sometimes it's the manufacturer service provider, or sometimes it's another group in the country that acts as an intermediary that we partner with. But it is challenging just because, working with different countries with multiple different projects, it's easier to, or at least the path we've taken is to try to create one product. So we're building a single product, but there are different needs and different requirements in different countries. And as Dr. Sabira mentioned, it'd be great to have a dashboard that did a lot of the analysis and AI of the data. But many countries view what that dashboard should look like differently. There's not necessarily a set standard. And again, we've tried to reach some consensus with WHO or with Global Fund or USAID on sort of what KPIs could be, or reporting indicators, those sorts of things that can cut across countries and develop that. But again, there's not an obvious, clear standard or support for that. So it's challenging.
Perfect. If I may, you talk about this concept of projects, and I think the word sustainability comes up a lot in this space. I mean, perhaps Sule, could come to you. The Global Fund is the biggest supporter of these programs globally, and you yourselves have to be funded on a cyclical basis. Talk us through a little bit about how you see sustainability and the visibility that you can and want to give to the countries that so depend on your support. Abah.
Okay, thank you so much. Very valid question, Chris. Again, I will speak in a private capacity, not for Global Fund, but I think in terms of sustainability, in terms of country ownership, in terms of scalability, these are things that are natural in global health, and I think that is something that we should promote, even whether we are technology manufacturers or we are IT companies or connectivity solution providers. Whatever our role is in the health system, I think it is absolutely very necessary that whatever we start with must be affordable. If it's not affordable, if it cannot be scalable, and if it's not available for the majority, I think we'll have a problem. And the problem is basically we are, again, excluding the people themselves that we have come together. We're trying to put our talents together to serve. So unless we have this consciousness from the start that our endeavors, our technologies, our input, our support, our contribution to the health system is affordable, it's something that can, be diffused, even as much as possible, if it means, I remember at a point in time, Chris, you remember, we're talking about local SIM cards at a point in time. I think you still remember. It's an evolving field in that area. When some of the technologies came in, we're talking about, okay, you have to use an international SIM card. But we said, no, people were saying, oh, how should I be paying for a SIM card based coming from America when I'm sitting there in Rwanda, for instance? Or why should I be in Angola and be, servicing an IT company, a telecom company that's based in Angola? So these are very critical things that technology must be, particularly technology for health, should and must be domesticated. We need to look at the long-term value chain that we have, that we're going to get. I think the goal maybe those in the private sector, the commercial sector, Chris, I don't know, probably it might be a different goal, but I think that if it's not available, if it's not affordable, then it may not be worth having. So again, sustainability, availability, it promotes the life-saving potential of every device, every solution that we put in place in the marketplace, and also particularly in the health sector, which I think the most driving force is life-saving rather than probably profit.
If I might, thank you, Sule. That was fantastic. If I might turn to Janet. Janet, you've been involved in diagnostic programs, all your career and in so many different fields. I've often felt in the past that people have viewed the diagnostic side as almost the nice to have, and it's more critical to get the patient the treatment, and doctors consider themselves pretty good at doing diagnosis without actually doing the tests. Just lifting it a little bit, do you feel that the diagnostics now, I think we saw the critical role they played in the COVID pandemic, but do you feel that diagnostics now are an integral part of the healthcare discussion, or do we think we have more to work to make the case of why even their need is sustainable? Over.
Thank you. So, over my career, I've seen a great transition, an increase in the role of the laboratory in healthcare decision making. I firmly push the need for diagnosis-based treatment because we still continue to see that there is too much syndromic treatment, and we're observing this incredibly alarming increase in drug resistance. A lot because treatments are being given without that diagnosis, and I think this is really where connectivity can help, because it can give us that rapid result back so that appropriate treatment can be given, and we're not getting inappropriate treatment and the cost of the consequences of that. So yes, we have made great strides forward in helping healthcare professionals understand the role of the laboratory, but I don't think we're quite there yet, and particularly in lower middle income countries where it takes a long time to get specimens to a testing lab. There's not a quick turnaround on results. The patient wants treatment, so we need to address every solution that can get faster access to diagnostic results. Thank you.
Fantastic. Well, that's a great segue into the question I wanted to ask Neha. It feels like once again we're on a panel where we want the perfect solution. We want it to be cheap. We want it to be connected. We want it to be immediate and quick and affordable. Are you seeing a move to more products that meet these specifications? Are the TPPs too ambitious? are people reacting, and particularly how does Path has provided support to so many of these different companies? How far away are we from almost the ideal world that obviously we all aspire for?
Yeah, I think, I think there's some good news and probably some areas for improvement here. But I think from sort of thinking about, Ed, your question from the supply and demand side, and I think there are enough push mechanisms where we are really seeing a lot of software companies as well as device manufacturers who are really interested in looking at the TPPs that are being offered. And I think there is some sort of convergence around what we can agree on in terms of the required versus the nice to have sort of product elements. I think where things start to fall apart is when we start talking about the demand side, and again, linking it to when and where are the solutions being used, what value are they adding, are the outputs of such solutions actionable and yielding impact and results, which I think ultimately will drive demand from sort of the global donor community, and also help with uptake from a Ministry of Health level. And so I think, again, there's a bit of this divide between what we can develop and what the technology can help us do versus how we're implementing and how we're seeing it used on the ground. So I think more work needs to be done on the demand strengthening side. And again, back to sort of the financial sustainability of these solutions, I think until there is some sort of mechanism where we can confidently move away from paper-based systems, there's sort of this dual parallel world of digital and paper-based. And I think that makes it really hard to put some of the foundational investments and the platform investments into fully moving away from paper-based systems. So, it's easier, I would say, to solve it on the technology side, and I think much harder on the demand strengthening side. And so I think we need folks like those on the call and our panelists to sort of really converge more on how we can sort of strengthen the demand and uptake of digital connected solutions, and also think about, where can we agree on how to make this information actionable and ensuring, in time and space that data is being available, as Janet mentioned, at the appropriate time to the appropriate individuals who have the appropriate levels of accountability to act on that information. And again, I'll just advocate for the patient as well. We need to really start thinking about how the patient has accountability and access to a lot of the information.
Got it. Yeah, I think that certainly. I mean, if we think about it, the mobile phone came about not because the mobile phone companies wanted it; they came about because people wanted to use them. But if I may turn the microphone back to Dr. Sabira, we heard from Sule the importance of ultimately there being demand and ownership and the willingness, as opposed I guess for countries at a national level to want these programs and to take ultimately to take responsibility for them. Clearly, Pakistan needs and is in need of support from the donor community and continues to benefit from that. But when you talk in the halls of Islamabad and in the halls of the Ministry of Health and in the more importantly to your colleagues over in the Ministry of Finance, I mean, do you feel they value getting this better data? Is this helping with the discussion around prioritization and how to both allocate resource and ultimately to make programs like this more sustainable, or do they not get it? Over.
Thank you, Ed. As far as the TV is concerned, currently all the funding is from the Global Fund, which is supporting this connectivity. But then we also have the largest province where they are spending a lot of money on digitalizing their data from the domestic sources. So it's not that the country has no desire to go digitalized. So we see even for the areas which are not digitalized in other part of the country, the largest province is moving forward, and they want their, even for the HMIS, the DHSI2 for the TV control program, which is being digitalized. So they want to that DHSI to interface with their own HMIS rather than going for adopting DHSI2, which is being used in the other provinces. So they want to integrate that in the currently. So yes, the country, I think there is awareness at all the level that this is a need of the day and they have to move forward. So if currently we have resources from the donor community and we are using this. But I think once if there is times come when we don't have resources, probably the domestic resources would pour in for sustainability of these activities. Thank you.
Apologies. Thank you. Thank you very much. I'm noticing that some questions are coming through in the chat, and that some of them are being answered. While we perhaps pull those together, if I might just ask the group one more question on what would you and we're going to have to keep it just to literally to a couple of minutes, but what would you like to see happen next? I mean, what is the 2024-25 goal? I'm sensitive that, you know, once we hit 2025, we're 5 years away from 2030 and the meeting of the Sustainable Development Goal target. But perhaps going backwards now, Sabira, could you tell me what would it be that you would love to see happen and in your dream over the next, let's make it realistic, 12 to 18 months, as opposed to thinking of the very, very long term?
So thank you. First thing, I would like to have a good dashboard, not only for the manager levels, for the intermediate tier, and for the health facility staff which actually are working. And then I would like to have these expert linked to DHSI to a system, so that the diagnosis goes in parallel with the treatment. So this is our target, and I don't know whether we are able to achieve it or not, but this is we keep on talking about that, how to interface diagnostic with directly with our district health information system, but we'll have to find a way. I think the main problem at the moment is finding a unique ID which would link the data of these with the DHSI2.
Perfect. Neha, would it be okay to turn the microphone to you next?
Yeah, sure. I think in my dream world, we would sort of achieve integration and use sort of digital connectivity as a means to an end to achieve that integration. And what do I mean by integration? I think, you know, we've already talked a little bit about the need for integration across health areas. But I also think integration really needs to encapsulate looking at laboratory systems and extending that out to primary healthcare systems. And when we do that, we are actually naturally going to start looking across diseases and across health areas. And we're also going to be able to really think about the patient cascade of care and capture a bigger segment of that cascade of care. The third part of the integration is, and one we haven't really touched upon today, is the integration of the private health sector and the public health sector. And I think connectivity is another really great mechanism to be able to connect the two sectors. And in doing so, we become a bit more patient-centric as well, because we know patients are flowing from private to public, back to private, based on preferences, local availability, accessibility, and so forth. And so when we think about connectivity in just the public health sector, we're sort of missing that piece. So I think integration across health areas, across facilities down to the PHC, and also looking at public and private integration.
Fantastic. Janet, if I might turn to you.
Thank you. And Neha stole some of my ideas. But in terms of integration, I would further expand that to, the other diagnostic instruments that are used to help in monitor treatment and side effects. And, those are not currently connected with the current connectivity solutions, but it's to move more just beyond the diagnosis. And I think if we were able to generate more data and evidence on the economic impact of delayed diagnosis or service interruptions, look at what would be the benefit of getting more people on treatment and reducing adverse outcomes, I think that might help with the sustainability and the funding arguments, because if we can see the cost of the consequences of not having connectivity, that might help ministers of health argue for the funds to sustain and expand this. Thank you.
Fantastic. It's becoming, the answers are getting better and better, but the bar keeps rising. So, Dr. Sule, this is now no pressure, but what would you like to see?
I like to see, every ambition we have expressed can be realized if there is funding, if there is financing for health. So I would like to see, my concept is saturation. And what does that mean? What I mean is we need to have systematic approach to health financing. Why will Dr. Sabira need to talk to the Minister for Health or a Permanent Secretary for Health in the first place? Most probably because there might not be enough. The needs are higher than available resources. So I think, in my opinion, and in my goal would be, what I want to see is to look at the entire inputs into the health system, whether it's diagnostics, whether it's medicine, whether it's anything, to be fully funded. Let there be enough resources so that connectivity becomes part of the health system. It's not just something that's coming new, like a fad that we need to just, okay, let's add this to it. No, this should have been there, ab initio. As long as possible, as far as possible as you can think of. But like the laboratory was neglected for a very long time, I think most probably when HIV/AIDS came in, then we began to gain some prominence. I think that the goal now would be to look at how can we support countries to build, to be able to, re-engineer the health financing strategies beyond depending on government revenues. So the moment we have maybe relatively adequate resources for health and budgeting is comprehensive, I think that whether you're talking about diagnostics, you're talking about connectivity or medicines or human resources or any pillar of the health system, those will be covered. I want to target, what I want to see is every country has a way and has a means to fund its health system. And if there are opportunities for partner support, those are catalytic investment. They are not, nobody, no funding agency can supplant a country. So that will be accepted, it's okay, we take it along, but then let us have a basis, a foundation for funding healthcare. whether the country is rich or poor, it doesn't matter. There should be a way to fund health system, and there are many ways. And many countries have done this successfully. You don't have to have a $10,000 GDP per capita to be able to fund the health system. So this is what I would like to see. So.
Fantastic. And Chris, can I bring you in at this point?
Sure. I would echo what Janet has said in terms of understanding the cost of not having connectivity, the cost of a disconnected system, or the pre-treatment loss to follow up, the mistakes and results, all of that sort of thing. I think people talk about sustainability and affordability and that the cost is too high. From my point of view on the ground, just seeing how complicated it is and how many challenges there are to keep a network of devices up across a country. In many lower middle income countries, rural areas where even the internet is barely available. In terms of a solution moving forward, I think some kind of connectivity framework or standard that both the developers, the device manufacturers could build toward, and local providers and system builders could sort of include those standards and maybe price the connectivity with the testing so that any solution that meets that universal standard or framework for connectivity can get funded by the donor or by the country or even by the manufacturer to include it in a per test price or a bundled diagnostic offering or lab offering for testing. But again, I think if we can see the value of connectivity with the cost of not having connectivity, then it makes more sense to see what we can pay for it and to build that in from the moment you start thinking of doing the testing.
Chris, there's one comment which I just wondered whether you could touch on, which came in for the chat, which talked about the mobile operators. Do you find that they're with you? Are they against you? How's SystemOne's experience been with working with the mobile operators?
There's a number of concerns with connectivity. You've got to deal with privacy and security. You've got to deal with managing the bandwidth of that data. If you put it out there, a SIM card or a router, and provide internet access to connect a device or a lab, often that internet access can be hijacked or repurposed for other things, and then the bandwidth can shoot through the roof. The providers typically charge per megabyte or per gigabyte, however the plan is, but they don't seem to offer any discounts to the countries or to the health system or to the people that they're serving. So I think that would be an interesting way to explore, some kind of partnership or ally with those providers in certain circumstances for certain kinds of data, like connecting diagnostic health system data.
Fantastic. Okay, I was nervous when we started that the hour would disappear incredibly quickly, but it turns out that concern was valid. But it's been a huge pleasure to have you all contributing. I apologize that we had technical issues with connecting Alex from Ethiopia to everybody on the line. But can I just summarize with some of the key messages which I heard? I heard that this need for an excellent dashboard and encouraging people to try and rally around a centralized dashboard so that not everything has to be bespoke. There's a lot of discussion around linkages into the DHSI, linkages across disease areas, linkages between the public and the private healthcare system, which I think is all makes sense. And the more patients feel that their data is being recorded and noted and going into a system, I think it has an enormous benefit in building trust in the system. I heard also about integration into other diagnostic routings and the challenges and helping to build the evidence particularly around service outages and both the positive and the negative. Sule, I've never heard anybody explain quite so well the need for the financing and making things sustainable and making the case for global health. And I think all of us are responding to the patients when we hear your call and the need to get this right. With that, we're at the hour. Chris, thank you also for your comments, and that I took that last point as a rallying call for this entire community that have joined us today. We need to bring and work with the mobile companies to bring them into the story. I'm Chris Egerton-Warburton from Lion's Head. It's been a huge pleasure to have you all with us today. Thank you so much to my panelists for joining, and I hope that those listening to this recording in the future find this as exciting and interesting as all of us have done today. Thank you so much for participating. Team, over and out.
Thank you.
Thank you.
Bye.
Thanks, everyone. Goodbye.
Bye.